Hey everyone, good to see you here. I'm a traditional Chinese medicine, TCM, doc with more than 20 years under my belt. On this channel, I'll be sharing some thoughts and interesting cases from my practice. So, for our first chat, let's talk about the common cold, something we all deal with. Colds aren't a big deal, right? Western docs usually say rest up, drink lots of water, and maybe take some meds for your symptoms if you really need to. Most of the time, that does the trick. But, let's be honest, colds can be a real nuisance sometimes. Like, some folks can't stop coughing for months, or they keep getting colds back to back. Feels like they're always down with something. In TCM, we think colds mostly come from what we call wind evil. It's like if you suddenly feel crappy in a breeze or when someone walks past you, stirring up the air, or if you're hot in your clothes but cold when you take them off. That could be a sign you're catching something. If you've got cold symptoms on top of that, it's a good bet you've been hit by wind evil. Why do we catch it? Could be you're overworked, not sleeping enough, or eating poorly, making your body's defenses weaker. Next up, we gotta figure out if your cold is more of a chilly thing or a fiery thing. There's a bunch of ways to tell the difference. Like, if you're really chilly but don't have much fever, no sweat, have a headache, runny nose with clear stuff, cough with thin white mucus, and aren't thirsty, you're probably dealing with wind cold. But if you're less chilly, have a worse fever, sweat that doesn't really flow right, have a throbbing headache, sore throat, yellow sticky mucus, a cough with yellow sticky phlegm, and your mouth feels dry, that sounds more like wind heat. A big clue is whether your mouth gets drier after catching a cold, that's often the telltale sign of wind heat. It's super important to get this right because messing up the diagnosis and treatment can make you feel worse. Like I said before, getting the diagnosis spot on is the key to treating a cold in TCM. Oh, and there's also a special kind of cold in the summer we call summer damp cold in TCM, but that's a story for another day. TCM is different from Western medicine because we really look at your specific body type. Some people are weaker and get colds that just won't go away. They usually feel tired, look pale, have a weak appetite, sweat easily, and feel damp. Even a little activity makes them sweat buckets, and a breeze can make them feel cold, leading to sneezing and sometimes fever. This happens a lot with older folks, kids, or people with chronic illnesses. In TCM, we think these patients are in a weak state, low on vital energy, making them easy targets for viruses. So, for these patients, we do more than just the usual cold treatments. We use herbs or acupuncture to boost their energy and improve their overall health. Of course, taking care of yourself after a cold is key. Make sure you rest enough, eat well, stay hydrated, and avoid things that can dehydrate you. Stick to light, simple foods and cut out greasy, spicy stuff and alcohol. Keeping a regular routine and not overdoing it helps a lot in getting over a cold faster. You can also try acupoint massage to ease symptoms and cut down the time you're sick. But, if your cold hangs around, doesn't get better with meds, or you're generally on the weaker side, then it's best to see a TCM practitioner. They can diagnose you properly and give you the right herbs. Sometimes, regular TCM care can help keep those annoying, recurring colds at bay. Alright, that's what I've got for you today. If you liked what you heard, hit that subscribe button.